नमस्कार, नेशनल खबर देख रहे हैं आप और मैं प्रज्ञा झा। आज नेशनल खबर की पूरी टीम जो है यहाँ दिल्ली में मौजूद है और बेसिकली एक एम्बेसी है, इथोपियन एम्बेसी, और यहाँ पर जो है इंटरनेशनल एम्बेसडर मीट 2024 जो है एक इवेंट, उसका कार्यक्रम जो है शुरू किया गया और इसमें तमाम जो एमएसएमई या स्मॉल और मीडियम जो एंटरप्रेन्योर्स होते हैं उन सभी पर फोकस किया गया। यहाँ पर कई सारे बिजनेसमैन और बिजनेस वुमेंस सभी मौजूद रहे और अपने बिज़नेस को कैसे आगे बढ़ाया जाए इस पर फोकस किया। और इसी कड़ी में डॉक्टर विश्वरूप रॉय चौधरी ने भी एक स्पीच दी और साथ ही ग्रेड सिस्टम को लेकर जो है उन्होंने एक स्पीच दिया, साथ ही डेमो भी दिया। इसके बारे में हम आपको आगे की वीडियो में बताएंगे और तमाम जो एम्बेसडर्स हमारे साथ मौजूद होंगे उनके बारे में भी बताते हैं। तो चलिए इस पूरा जो प्रोग्राम होगा उसे आप आखिरी तक देखिए और समझिए कि आखिर कैसे एमएसएमई जो स्मॉल या मीडियम जो एंटरप्राइजेज है उसे आगे बढ़ाने का काम किस तरीके से किया जा रहा है।
Honorable His Excellency and my dear friends, now it is already 5:30 and I am the last speaker, right? So this is the time when the body starts reducing the blood pressure, it starts reducing the body temperature a little bit. Actually, body starts preparing you to sleep. So it is going to be very hard for me next 10 minutes to keep you awake. But don't worry, I have some tools and I'll not let you sleep. When you enter a room like this and if you have to identify the healthiest of the person, so what is the diagnostic method? Just by looking at it, how to know who is the healthiest one? So if you can spot someone who is fidgeting his leg, most likely he is the one who is not suffering from diabetes, BP, heart disease, kidney failure. He will not be fat, right? Even if other lifestyle may not be good. So just when you are sitting and if keep on moving as a habit, so these kind of people, they don't suffer from the disease. They are blessed. Interestingly, you can all try when you go back to your country, whether it's Africa or Asia, you'll find tailor. Those who use the leg machine, movement of leg, right? So they have a sedentary lifestyle. They sit for about 10 hours a day for last 50 years. But in India, I could not find my volunteers all over. We have 20 hospitals. We could not find a single tailor with diabetes. And then we put a challenge through our social media, through national television. If any tailor with diabetes come to us, I will give you $1,000. This challenge I kept on 23rd January last month. Till now, we could not get even a single tailor with diabetes. So here comes the medicine, gravity as medicine. Those who are not having the machine, only legs.
I know one tailor who has a leg machine. He has a type 2 diabetes.
Then you can get $1,000. Then you can get $1,000.
I will refer to you.
Thank you. So our definition of diabetes is anyone who is having blood sugar less than 250 mg per deciliter. That is the true definition. But over the year, if you see the Harrison book of medicine, 1978, this is the definition of diabetes. But over the period of time, the definition was squeezed so that more people can be called as diabetes. So when I am talking diabetes, remember it is 250 mg per deciliter as a random blood sugar. So important is, I was talking of the time, that is about 5:36 p.m. right now going to be. If you decide that you will not eat after this 6 p.m., then if there is some illness like diabetes, BP, etc., it will go. If it is not there, it will not come. One small thing, don't eat after 6 p.m. Right? But today's exception, you can have your dinner after this, right? Don't leave here, right? So now this this kind of things which we do it in our hospital. And the people with chronic kidney disease, the one who are dependent on dialysis, that is in a week 3 dialysis, 4 dialysis, or 2 dialysis, 1 dialysis, they are the one, they can escape the dialysis by using what we call as gravity as medicine. Gravity is something which is available free of cost. Here I was talking about, when we move your legs, what is happening here, we know there is a heart, but we don't pay attention to the second heart, which is the calf muscles. This calf muscles, it get activated only when we move it while we are sitting. Then it get activated. This means when we are sitting and moving the leg a little bit unknowingly also, some people by habit they do it, then they are activating the second heart. This means 2 hearts are supporting the blood circulation against the gravity. And when it happens, then these kind of disease, they escape these kind of disease. How it happens, I'll just take 10 minutes. I have some tools to help you explain. This is what I invented to get the gravity inside the body. And this is our hospital, 20 hospitals, you can skip that. Next. Agla kar do. About 14 years back, I wrote this book with the idea that how we can free people of diabetes by just changing a little bit in the diet. And the diet is very simple, which we call as DIP diet. This you can try if anybody is taking blood sugar medication or insulin. That is what, till 12 noon you be on the fruit breakfast. Eat 3 to 4 kind of fruits, especially the fruits which are sweet, like mango or maybe grapes or any other fruits or any fruit of your choice. But at least this is the formula. My body weight is 70 kg into 10, that becomes 700 grams. That is the amount of fruit which you have to eat till 12 noon. Right? This becomes the medicine. This is the step 1. Step 2. When you sit for lunch or when you sit for dinner, whatever you want to eat, you keep it in plate 2, what you have been eating already. But before that, you eat 4 types of vegetable, if you can eat in raw. Tomato, cucumber, there are certain kind of vegetable, can be radish, carrot, can be eaten in raw. And formula is body weight into 5. My body weight is 70 kg into 5, that becomes 350 grams. This becomes my dose of medicine. Before starting the cooked food, I eat this, lunch and dinner. And only the last thing, if you can avoid 2 kind of things, anything which comes out of factory, packed food, anything which comes out of animal, whether it is meat or dairy product, etc. If you can do it, then if you can do it, by 3rd day, you will be forced to taper down the blood sugar medication. By 7th day, you will be forced to taper down the blood pressure medication. And it takes about 15 days to 21 days to see a clear-cut difference in your all kind of pain. It takes about 1 month to reduce about 5 to 10 kg of weight if your BMI is more. So these kind of results we have been seeing for last more than a decade. And clinical trial was done by Government of India, Government of Nepal, and also in Malaysia. They also found a consistent same result even for chronic kidney disease patients and those who did not enter the dialysis. Not very serious, they are just moving towards the dialysis but not yet entered the dialysis. Now come the patient who are truly sick, those who are dependent on dialysis. Then we have to add certain thing along with this, and that is what we call as gravity as medicine. And here what we do, what I call as the GRAT system. This is a system which we would like to take to Africa as well, if you allow. The GRAT system is along with this. This is the diet which I just told you. Along with this, this is very, very important. We all are lucky, we have been sitting since morning, but the accumulation of fluid and the blood is not there in the legs. But unfortunately, the CKD, chronic kidney disease patient, if they sit like this, the blood and fluid will start collecting towards their legs and the limbs. And that's how they are different from us. Because their gravity becomes powerful and the heart becomes weaker, and that difference and the fluid start depositing there. Here they need the dialysis. And what we do, a simple technique, as you can see here, we make their incline the bed by 10 degree. When we incline the bed by 10 degree and ask them to sleep like this, lie down like this for about 2 hours, the effect of gravity is now in the opposite direction. It is in the same direction as the heart. By making this one small change, we see a great amount of result, and the chronic kidney disease patient, they start reversing. They start getting cured, their symptoms start vanishing, their blood pressure start reducing, their symptoms of swelling start reducing, their urine output start increasing. This is we see in majority of the patient, but there are some patients who are in a very, very advanced stage. Then we add one more thing in our hospital. This we do in hospital. We put the patient inside the bathtub, as you can see on the screen, or you can see here, or you can see live also the video. Here you can see on the video, these are chronic kidney disease patients. Otherwise they were going to, this is a picture of my hospital, right? And they were going for dialysis twice, thrice, or once a week. Instead of that, we made them sit in a bathtub, as you can see, with a water temperature 40 degrees Celsius, and for about 2 hours. And the water level, as you can see, till neck. If you do this, this becomes a natural dialysis. Instead of dialysis, we do this. The interesting thing is, if they can do it for 3 to 6 months, then they don't need even this. The kidney is repaired. Till now, you have never heard that kidney can be reversed, kidney disease can be reversed. Yes, it cannot be reversed with drug or dialysis, but it can be reversed if we use this technology. This is what, till the neck, we are having the atmospheric pressure, and below the neck, the water, atmospheric pressure plus water pressure. And when the heat of 40 degree happens, the skin becomes the third kidney. Skin plays the role of third kidney, and the things which is not able to, what is not able to discard through urine, through kidney, that start getting out through the skin. As a result, when this man, he comes out of the, after 2 hours, his body weight reduces by about 500 grams to 1 kg. His blood pressure reduces by 20 mmHg, and his swelling goes away. His urine output increases. This happens in the first session itself. Along with that, the diet is there. Along with that, the head down tilt, that becomes a protocol, and which we started about two years back with one hospital. Now in India we have 20 hospitals. We have one hospital in Kuala Lumpur, Malaysia. We have just started one hospital in Nepal, and some camps in Vietnam, and so the results are similar everywhere. So the real true picture, if you see, next slide, this you see head down tilt, and this is hot water immersion, and these are so simple, it can be even done at the home. And most of our patients with this, they are in our hospital for 7 days to 10 days to understand the whole process, and then they go back to their home, and they do it at their home itself. Because they have to do it for 3 to 6 months, it is not possible to be there in hospital for 3 to 6 months. So we train them how to do it. We monitor them through our app, and slowly we taper down the dialysis. The dialysis can be tapered down if they are taking 2 dialysis per week. Within 15 days, it becomes 1 dialysis in 10 days. Then about 1 dialysis in 15 days, and then we remove the dialysis altogether. So till now, if you go out and ask anybody what is the solution of the person who is on the dialysis, the only thing they will say is the transplant, kidney transplant. That means you have to find a person who is agreed to donate his kidney. This means he will be left with 1 kidney. And the most important thing is, shocking thing, surprising thing, the 1 kidney, even after getting the transplant done, it takes about, sometimes the transplant fail immediately, sometimes it takes about 3 years and then fail again. Person again goes into dialysis. This means transplant is not a solution, but this is definitely a solution. We did an observation study by Sridhar University in India, and they found when they do this, 75% of our patient, they could get rid of dialysis and the medication and all the symptoms. 75%. 25%, of course, they are not able to manage to come out of it, surely, but at least they are able to reduce the number of dialysis. Even then we call it a success. So here we have to understand with the one simple, now when I do this, why it is going down? Because the power of gravity, right? But if I want to slow the speed, I just have to incline it. But if I incline it up like this, instead of going down, the one will go the other way around. So now think this is your body, and now think the inside, it is not the sand, it is the blood, right? The same thing is happening here. We are trying to give the pressure in the reverse direction towards the kidney, so that the reverse process starts, and then the kidney gets some time, and the skin helps, Medically, skin is called the third kidney. If we can activate the skin for some time, the kidney gets a time to repair. Now, from where we got all this inspiration, and that is the interesting thing. And here, important is, for very, very big looking problem, there can be a very simple solution. But sometimes the solution is so simple, people are not ready to believe. Right? So I'll give you one example, and in next 2 minutes I'll close it. For example, one small experiment we can do. Excellency, this one small experiment, and sir, one experiment, and one, anybody, Gabruji, this Gabruji ko dena, yeah, there. And if I ask you a simple question, you are having this in your hand, and I ask you, take it like this, and I ask you, without moving this, you have to take out the piece of wood inside. Without moving the outer, you have to take out the piece of wood. Can you try it? Right? So now, it looks, first appearance, not possible. Then somebody may come with some tools, right? They will take some hammers, some nails, and they will point out, and then they will use some technology, some magnets, and some adhesive. So there will be an industry around taking it out, right? So this is how, and then they will say, oh, success. In that process, they may break it also. Now simply, what I do, I use the gravity as medicine to take it out. Now what I am doing, as I am putting the water inside, it comes out. Can you see that? It comes out. So why it comes out? The water goes under because the gravity, and it is lighter, it will come out. So with this I am not harming it, very simple solution, but I am harming that industry which was built around it, right? That industry is gone. So we have to understand, the Embassy of Ethiopia, that we are keen to extend our hospital and technology in Ethiopia. We are keen to invest there. But if we come, the existing dialysis industry, right, that will be threatened, and whether, because that is also giving some revenue to Ethiopia and rest of the world, right? So that decision your country has to take, because if the people start getting cured with gravity as medicine, with heat as medicine, here we are applying heat, with food as medicine, right? So these things are available free. And the last 1 minute, how and from where we got the inspiration. I got the inspiration. So inspiration came from Africa. From where this idea came? It came from Africa. And I'll talk about the biography Wilma Rudolph, an African American girl. Till 12 years of her life, she was having paralysis, polio in left leg. She could not walk. And that time, 1950, 1960, the black people were not allowed to go and visit the MBBS MD doctors. They are not allowed. White doctors will not see the black people. So a black traditional doctor advised Wilma Rudolph's mother, just put her legs in hot water and massage. And she followed that. Within 8 years, not only she could cure completely, she became the fastest running woman on earth. Just to conclude, Wilma Rudolph made 3 world records. Great. So this was an inspiration. Paralysis cannot be cured, that is what you know. It cannot be cured with the drugs. It cannot be cured with the surgery. By using heat, by using water, by using gravity, it can be cured, and here is the proof. Right? This means it is already there in the science, but it is hinted somewhere. But she has achieved such a milestone. From the history, nobody can erase this. But yes, it can give us inspiration coming back to the nature. So, thank you. With us, we have about 20 hospitals in India and 250 doctors. And with me, Dr. Sanju Khare, right here, please come. And she is a training head for all the 250 doctors. So first what we do, those doctors are MBBS, MD doctors, all degree holders. First we have to unwind them. Right? First we have to erase their memory, what they learned in those 5 years or 7 years in their medical college. And then we give them the new technology that there can be very easy solution for the most difficult looking problem. Right? So I have some books for His Excellency. These are the books, and it has all the proofs what I am saying with all the evidences. These books are for the Ethiopian Embassy, His Excellency, and Gabruji for him. So what I said, the evidence are here, sir.
Thank you.
So I hope that His Excellency will think about it and allow us, with all the risks that pharmaceutical company, how they will take it, but allow us to work with you in your country. And I think the inspiration came from African girl, so it should go to Africa back. With this, I conclude. Thank you.
Very soon to see you in Ethiopia.
Thank you, sir. Thank you, sir.
Thank you.
Thank you, sir. Thank you, sir.
Sir,